future of HIV prevention, I think it'll look like, what will it look like? I think it'll look like a couple of different stages. I think like the first stage, before we get to the end of HIV, the first stage I believe is going to really be the need for the integration of biomedical interventions along with behavioral interventions. The second wave, I think, will definitely will be the end of HIV, whether it's through an HIV vaccine or whether it's through the other biomedical preventions that really reduce the rates of HIV.
More political involvement and education to politicians.
Routine HIV testing, that's not even a question. HIV prevention should have better advertising, better social media that destigmatizes HIV.
The future of HIV prevention should be the community. There are concerns right now about the lessening of the community voice in HIV prevention, and I think that's a mistake. And as we move forward, I think it's important to kind of keep those community voices at the table.
HIV is such a layered issue that when we talk about prevention, we talk about care, we talk about treatment, we talk about housing, we talk about education, we talk about divisions among people geographically. HIV is it's an interconnected issue that impacts communities in a number of ways.
I think the future has to look a little bit more along the lines of HIV prevention with positives.
Somewhere down the road, we're going to have something that prevents HIV and syphilis and hepatitis and HPV and pregnancy at the same time, and it's something that's going to do a lot at the same time.
The future of HIV prevention for me looks like collaboration. So for example, I work with a lot of faith-based communities, and they can do the work and they have access to people that the average Department of Health, for example, doesn't have access to, and they can spread the word in a different way. You have social media experts who are able to spread the information in the way that a local CBO might not be able to. You have schools that have the opportunity to teach young people about prevention and treatment and access to care.
We need to bring all the resources to bear that we can muster. I think we need to get as many people on board as we can. I think that in New York City in particular, we've already begun to build a good relationship between government and community. I think we need to continue to build upon that relationship. I think we need to start to link hands nationally. I think there's light at the end of this tunnel, and we need to work together very aggressively in order to make this thing come to an end as quickly as possible.
For more information about the New York City HIV Planning Group, you can contact us by phone or by email, follow us on Twitter, like us on Facebook, or watch us on YouTube. Please subscribe. We hope to see you soon.